Good morning, it is Jane with Scraptascyarns, and today is another hashtag 50 gone by 2024. As always, let's start out with a medical disclaimer. Always check with your physician or healthcare people before starting any exercise program or following any advice that I give here. The information here is my personal research into different health topics and not to be considered medical advice. You know, the weight loss has been going really well. Have no issues. Then all of a sudden, I've started to gain. And I'm like, what is going on? I haven't changed anything that I have done, so it doesn't make a whole lot of sense. However, there are reasons that we sometimes have unexplained weight gain when we've been working so hard to lose weight. So let's discuss some of those, shall we? First of all, there are 13 common causes of sudden and unexplained weight gain. And here we go. And we've covered some of these in the past, so should be no surprise, right? Are you also totally exhausted? Remember, it's totally normal to gain weight as you age. Well, that just sucks right then and there, doesn't it? After all, thanks to something called responsibilities, you probably aren't moving around the same way as you were when you were younger. In other words, you're no longer running up and down the playground all day. Less activity plus the natural loss of muscle mass can both contribute to a slower metabolism as you get older. But if you're experiencing a sudden weight gain that just doesn't seem to make sense, and it doesn't seem to have to do with your normal life changes, there may be a sign that something odd is going on with your body. Think out-of-whack hormones or some kind of other sneaky health conditions that are causing your metabolism to misfire. Ultimately, you'll need to work with your doctor. That's right, your healthcare provider, to get a clear explanation for why your unexplained weight gain has happened. Before visiting the doc, as always, keep a log of everything you eat, as well as your exercise habits, including activity outside of your workouts, for at least a couple of days, if not a week or so. Maybe you're eating more calories, or you've spent weeks sitting down more than usual thanks to a heavier load. Yes. Your doc can help you get to the bottom of whether any lingering health issues might be causing the weight gain, and there are tons of reasons for unexplained weight gain that have nothing to do with eating more or moving less. And here's the cause of mine. I mean, it wasn't a big weight gain, but you know, you don't expect it. Hypothyroidism. When a young woman walks into a doctor's office with unexplained weight gain, the thyroid is the first place most physicians will investigate. And for a good reason. A whopping 1 in 8 women will develop a thyroid disorder in her life. That butterfly-shaped gland in the neck is responsible for secreting a hormone that regulates the metabolism. And if you've got an underactive thyroid called hypothyroidism, the metabolism may slow down, triggering weight gain. Women with hypothyroidism may also suffer from low energy levels, fatigue, dry skin, hair loss, hoarseness, or constipation. Notice any of them and you should actually chat with your doctor about running some tests. It's an easy blood test. Simple and easy. And that is the result of mine. And as you can tell, I still have issues with the voice this week. Well, my numbers are down again. So, we're going to have another medication change. Yippee! One other thing is, polycystic ovary syndrome. This is called PCOS, and there are a lot of women that have this. Research actually shows that many as 1 in 5 women have polycystic ovary syndrome, an endocrine disorder that throws off the balance of reproductive hormones, estrogen and testosterone. Yes, we have both of them, ladies, and can trigger a number of unpleasant symptoms like wacky periods, facial hair growth, and migraines. Yep, PCOS can also muck up the way your body uses insulin. Yippee doodles, we talked about that last week. And that hormone, which insulin is a hormone, is responsible for turning sugars and starches into energy. Which means, you've got it, unexplained weight gain around the midsection is common. If your menstrual cycles are off, a gyno doctor is in order. So they may need to check on those as well. Depression or anxiety. It's amazing how those things trigger things that are going on in your life. So, depression and anxiety. When you're stressed, you're thrown into fight or flight mode, and you'll get a surge of adrenaline along with a heavy dose of a hormone called cortisol, which is supposed to help you restore energy reserves and store fat. Because, you've just sprinted 3 miles from a tiger. Alright, that was overkill. You're starving. The problem? Lots of us get chronically stressed sitting at our desk all day or just living crazed lives. And that's been mine this week, getting ready for that craft fair. When your cortisol levels stay elevated for a prolonged period, then your body starts to continue to store fat, which can lead to weight gain. If you've persistently felt down in the dumps or anxious, have trouble sleeping, feeling fatigued, or you've lost interest in the stuff that used to make you tick, talk with your doctors or a mental health pro who can help make suggestions for getting back on track if stress seems to be the culprit behind your sudden weight gain. Insomnia. How many of us suffer from that? Of course, if you crochet or knit, many times you get up and crochet and knit. There's nothing like a busted night of sleep to make a girl crave sugar and fat. Yeah, easily. That's because Miss Shut-Eye does a number on your hunger hormones and metabolism. Sleeping too little raises ghrelin, which is a hormone that signals it's time to eat, when lowering your levels of leptin, the hormone that says, I'm full. Don't we wish we had more of those? The result is a totally unsatisfying chow fest the next day, putting off sleep to just watch one more episode. That could be contributing to a sudden weight gain. Sleep was found that most people who slept 1 hour per week more lost more fat than those who slept an hour less. The people who slept less lost less, even though everyone in the study ate the same number of calories proportionate to their weight at the start of a study. Don't you find that interesting? I do. Those things, Then there is small intestinal bacterial overgrowth. That is called SICO. Sicko. Let's call it sicko. The gut relies on good bacteria to function well. Probiotics, anyone? It's a good idea. But there's also bad bacteria chilling in your digestive tract. When that balance of good to bad gets thrown off, small intestinal bacterial overgrowth happens. And it can take place, triggering extra gas in your GI tract along with the bloating, abdominal pain, diarrhea, and you guessed it, sudden weight gain. Now, doctors really aren't sure how that triggers extra pounds. But the treatment for it typically includes antibiotics to treat that bacterial overgrowth. Perimenopause. I'm so glad I'm through with perimenopause and menopause. The transition period to menopause, which can start as early as your mid-30s, but lasts into actually most of it starts in your 40s. Triggers hormones like estrogen to rise and fall unevenly, which can cue weight gain in some women. There are a lot of other signs of perimenopause, which are also irregular periods, hot flashes, mood swings, and a change in your libido. Sometimes your doc can usually guess that out with her eyes closed, or his eyes closed, if you just tell him what's going on. Compound perimenopause with those other inevitable body changes that happen with age, like body mass loss, an increase in body fat, and you may feel the scales tipping fast. Talk to your doctor to manage the change in stride. Medication. There's a laundry list of both prescription and over-the-counter meds that can trigger sudden weight gain or water retention, which shows up on the scales as extra poundage. Antidepressants. Wow. Most commonly, the selective serotonin reuptake inhibitors, such as Paxil, Lexapro, and Prozac, may affect the appetite center in the brain. Meanwhile, beta blockers, meds that reduce blood pressure, can slow your metabolism, and of course steroids. Prednisone is the big one. An anti-inflammatory that causes water retention and an increase in appetite can add on pounds. And yes, with prednisone, we usually call it moon face because you'll see most of it happens right in your face. When you're on prednisone, you get a more rounder, fuller face. Some things, even like over-the-counter antihistamines, Benadryl, can disrupt the enzyme in the brain that helps regulate food consumption, can trigger noticeable weight gain. A word to the wise. Don't take turkeys, don't take pills, cold turkey. Chat with your doctor and find out what is going to be more waist-friendly choice for you. Cushing's disease. A super rare condition called Cushing's disease. Only 10 to 15 people per million are affected, but 70% of those are women. Causes excess cortisol production and can trigger excessive weight gain just around the abdomen. The legs and arms usually stay lean, and the back of the neck. Cushing's typically presents with significantly low energy, complications like diabetes, high blood pressure, and high cholesterol. But the telltale signs is very large red stretch marks on your belly. If that sounds familiar, talk to your doctor. Dehydration. You wouldn't think that would help, but it does. Causes a lot of weight gain. That's the reason behind bloat. And it may have just as much to do with the water you forgot to drink as the food you ate. Most of us are not drinking nearly enough water. That's because many of us mistake the feeling of thirst for the feeling of hunger. Confusion, tiredness, lightheadedness are all signs of even mild dehydration. Sounds a lot like how we feel when we're hankering for a snack. So if you're feeling that, maybe you should consider having a glass of water first, and then in 20 minutes if you still feel the same. Mixed signals aren't the only possible culprits behind your unexplained weight gain. Adequate hydration increases mitochondrial function. What that basically means that it increases your metabolism. Without enough water, your cells can't do their thing, namely convert your food into energy, quickly and efficiently. That's another reason to drink more water. Now this one is very serious. Well, they're all very serious. But a lot of women don't recognize this, so something to consider. Ovarian cancer. In rare cases, an expanding belly is a result of an ovarian tumor and fluid buildup associated with it. Patients come in with abdominal bloating, and their usual pants are not fitting. Sometimes a tumor is so large it can cause distension of the abdomen. Women are more likely to be diagnosed with ovarian cancer after menopause, but it's important for women at every age to look out for this symptom, as well as feeling full too quickly, pain in the lower stomach area, extra pressure on the bladder. So see your doctor if that bloating persists, especially if your family has a history of ovarian cancer. Smoking. That's another one. You quit smoking. Smoking can often act as an appetite suppressant, so when you quit, the cravings can hit strong. Smoking leads to a rise in dopamine, the neurotransmitter responsible for instant pleasure. It's the same kind of pleasure when you get to eat a sweet snack like ice cream. Quitting smoking causes that dopamine level to drop, but your cravings for it still remain. And this craving for a dopamine hit can sometimes lead to eating something satisfying and more than usual. When one quits smoking, the body still has cravings for dopamine, and often people get this craving from an excess intake of refined sugar and starch. Candies, starchy foods. Again, they gain weight. To counteract the lower levels of dopamine once you quit smoking, it's important to engage in other behaviors, like exercise, meditation, that help release those feel-good endorphins and also provide a nice distraction and healthy new habit. Diabetes. That's a big one. Type 1 and Type 2 both require insulin management in order to keep blood sugars levels regulated. Type 2 doesn't always result in insulin, but if you have it for long enough, you will go on the insulin. People with Type 1, the pancreas essentially do not produce enough insulin, so those that have it need to regularly give themselves that hormone, insulin. Insulin allows the body to absorb glucose or sugar and use it for energy. Type 2 diabetes is usually associated with insulin resistance from a poor diet and sedentary lifestyle and unhealthy eating behaviors. But that's not always the case, so keep that in mind. That can usually contribute to the weight gain itself. Type 2 diabetics always have a higher baseline insulin level, which by itself means more weight gain, typically around your belly. But an increase in insulin from external hormone treatments can also lead to weight gain. Insulin lets glucose into your blood cells so that it can be stored for energy. But if you're eating more calories than your body needs, your cells will take what they need, leaving the remaining glucose to be stored as fat. You know, sometimes it seems like our body just works against us, doesn't it? To counteract weight gain, it's important to closely monitor your diet and avoid eating too much fast food and foods high in refined sugar. And consider, refined foods also means sometimes we're eating out too much, and I don't know if you've noticed, but portion sizes have gotten a lot bigger. So, other cancers. Most cancers in their early stages will result in weight loss instead of weight gain, unless it's a cancer that causes the release of cortisol, like a tumor in the adrenal gland. However, as cancer progresses, it can cause weight gain. This weight gain can be due to the growth of the size of the tumor, or if it spreads to other organs, like the liver, which can cause fluid buildup in the stomach or the stomach cavity. Don't be too alarmed, okay? This is usually a worst-case scenario. Most cancers will cause other symptoms that will cause you to see a doctor while they are still in an early stage. So, when should you see a doctor for sudden unexplained weight gain? First, you need to take a look at what your lifestyle is like. If your diet is poor, it's normal to gain between half a pound to a pound of weight per week. Your menstrual cycle can also cause your weight to fluctuate between 4 and 5 pounds, depending on the stage of the cycle you are at. But when is weight gain a cause for concern? If you're gaining 1 to 2 pounds or more a week, you don't need to see the numbers going down. And you don't see the numbers going down. Sorry about that. Yes, you do need to see them going down. Then it's time to see a doctor. If one notices that they are gaining weight rapidly, 1 to 2 pounds a week, and it's not related to a menstrual cycle, poor sleep, anxiety, depression, snacking, or overeating, you should see your primary care physician, who will then sometimes you may have to push it, do a thorough history and physical, as well as appropriate laboratory workup to find the causes of your weight gain. A doctor can then work with you to determine whether an underlying condition is determining your weight gain and find appropriate remedies to help you maintain a weight that makes you feel good. So there you have it. You should always consult your physician if there's something that's going on that you're doing and it's not working. That daily log is a great help in determining what's going on. But with that daily log, you have to be honest about what is going on when you're putting those things into that daily log. You can't say, oh, well, I just had a tablespoon of peanut butter. Well, a tablespoon of peanut butter is like almost 200 calories. That's a big thing. So be honest in your documentation if you're doing food logs, exercise logs, because sometimes you can find out where the problem is simply by looking at that. All right. I thought I would tell you how the craft fair went. It went well. The gnomes were a big hit, and I did some kitchen towel angels, and those were a big hit as well. But I will tell you, I had crocheted 3 pumpkins. One was a blue chunky yarn pumpkin, and then one was a real small in kind of a rust color, and then I did another larger one in that rust color, and I had taken some sticks from out back, cut them down for stems, hot glued them into them. Those were supposed to be my table decoration. But I had a lady come up, and she goes, "Are those for sale?" So I looked at her and I said, "Sure. How much do you want to give me?" She goes, $5 enough? I said, "Sure. Go ahead." Those were just leftover scraps of yarn that I had, so I just decided to make those into pumpkins. So my table decorations sold as well. We had a good laugh about it. It was a great lot of fun. The craft fair was at a Christian women's luncheon, so there were probably about 130, 140 women that attended this. 118 women who attended this. So it was pretty good. I had a good time. I had a lot of laughs, It was enjoyable. And a lot of these ladies I know from other places that go to these. So it was just great fellowship, as it always is with these kind of luncheons. So yeah, it was a great success. I had fun. I only do this once a year. I don't do other craft fairs. So, you know, I don't expect much when I do go. But like I said, it was a lot of fun. All right, guys, that is it for today. Remember, be kind to one another and get out there and see this big, beautiful world, because it is awful pretty, especially this time of year with those leaves turning. Check out a few sunrises, sunsets, because they're gorgeous too. All right, see you guys soon.